Hi, my name is Joanne Diodorus, and I'm going to be presenting today on a disease called lymphedema. We're going to first talk about chronic versus infectious diseases. A chronic disease is a condition that develops slowly and lasts a long time, usually for life. Examples of this type of disease would include diabetes, heart disease, and lymphedema. They require ongoing care, so a maintenance program for life. Infectious diseases, they're usually caused by things like bacteria, viruses, and parasites. And they are transmitted from person to person and usually can resolve with some sort of treatments like antibiotics or just your immune system. Some of the diseases that are included in this area are things like the flu, COVID, or STDs. Lymphedema, and what is it? So, lymphedema is a chronic disease. It is a condition that causes swelling, could be anywhere on the body, but usually shows up mostly on your limbs, so your arms or your legs. It's swelling that doesn't go away even with diuretics or elevation of the legs. Um, a lot of times we are affected because of some sort of surgery or procedure or cancer, including radiation. Sometimes it can be caused by being overweight. But a big thing about lymphedema is that it's our lymphatic system. So, our lymphatic system, which everyone has, is our drainage system of the body. So, our lymphatic system is what takes all the water, your water retention out of your body, especially when you've worked out or you're super swollen from hormones or things like that. That's our system. When our lymphatic system is too taxed from constant swelling, what ends up happening is our lymph nodes are affected. So, our lymph nodes are located all over our bodies. We have lymph nodes in our throat area. We have lymph nodes under our armpits. We have lymph nodes in our groin area. And these lymph nodes are our system to help pull the fluid out. Without them, we would just have really swollen extremities. And that's exactly what this is, as you can see in our picture from the stage 1 to stage 4. Um, so a lot of times the lymph node in the area of the swelling is too taxed or is no longer working. And fun fact that our lymphatic system is one of the only systems in our body that does not regenerate. Our nerves, our tissues, our muscles, they all can kind of regenerate a little bit. And our lymphatic system, once it stops working, it stops working. Symptoms of lymphedema. So, patients who have lymphedema will report just tiredness of that extremity, heaviness, like they can't lift up their leg or their arm. They usually tend to have obviously swelling in the area, but you'll see like excessive swelling, sometimes even skin folds and things like that. And in comparison to the other body part, your other leg or your other arm, you can see a huge difference. And you'll notice that the swelling is just not normal. You'll feel kind of that numbness because of the leg is so huge or the arm is so huge. You're just more susceptible to infections on the skin and some of the things that you can't necessarily see or feel is the hardening of the skin. So when you touch your skin, you can feel how soft it is. When you touch somebody who has too much swelling in one area, there is a very, very hard area and it feels almost like leather. Impact of lymphedema. So, the type of things that patients can report that they have issues with is basically everyday things, walking long distances or just walking in general, dressing themselves because of their limited range of motion, because their limb is so big. They have a hard time getting in and out of cars. I mean, just doing very, very, very small things during the day. A lot of them will complain about, I mean, obviously emotional challenges as they kind of don't know how to react with this type of swelling. And of course, the aesthetics that it has. If you're looking at somebody and you see that their leg is 3 times the size of their other leg, a lot of patients kind of report just embarrassment and not wanting to go out in public. So mentally, it can play a huge role. You are more susceptible to infections, like I had stated. So you have to take better care of yourself in the skin aspect. And it just affects your overall quality of life. You know, they're having to sit there and having to manage their life the entire time. Treatment and cure for lymphedema. Unfortunately, there is absolutely no cure for lymphedema at this time. It is definitely a very under-researched diagnosis. They are starting to kind of look into what other things they can do, possibly surgery to transfer lymph nodes, but there has not been, in my understanding, any studies of consistent success with that here in the United States. I know that there's some specialists in Germany and places like that, but here in the United States, there's not too many people who are actively doing this type of surgery. And insurance is definitely not fully covering these types of surgeries as well. So but the things that can be done to help manage this type of diagnosis is MLD. So we have manual lymph drainage, which it's a special massage that helps to kind of pull the fluid out of the affected area. We use a lot of compression garments. So, we try to keep the limb as small as possible. You don't want it to get any bigger because you start to see things like little fluid coming out. We call it lymphuria. Or you'll see even sometimes like yellowing plaque from like infections due to the skin being wet from everything seeping out because there's nowhere else for it to go. We educate on good hygiene, you making sure that you're clean as possible, even if you have this type of situation, showering, making sure that you're washing the area as often as possible. Exercise and elevation. So this will include use of your compression garment and making sure that you try to massage out the swelling afterwards. But yes, exercise is great for you. Elevation can help, but normally the reason why people find out or are diagnosed with lymphedema is that they tried to use elevation to decrease the swelling and it didn't work. A lot of doctors will try to give diuretics, which is like a water pill. Basically, it just takes all the fluid out of your body, but that doesn't work either. So again, that's kind of how a lot of people are being diagnosed, is when they realize that none of those things are helpful. And then a pneumatic compression pump. So a pneumatic compression pump is a tool that's used to mimic the human hands in as far as MLD, except that they can use it at home, because you have to think to yourself, it is very difficult for these patients to already walk and get around. Going through types of therapy like this would require them to go at least 2 to 3 days out of the week minimally to be effective. And so if you can't get there, a compression pump is a good alternative to be able to set up at home and just put your foot in it. And it's like a sleeve. You put your leg or your arm in it, and it just pumps the fluid out for you. The behavioral risks. So, some of the behavioral risks for lymphedema include being very inactive, um, and of course, weight gain. If you are inactive and you have gained weight and you had just had surgery, especially when you can't move as much, that puts you at a really big risk for lymphedema, just overly taxing of the lymph nodes and no movement, no help from anywhere. Um, so gaining weight, again, like I had stated, just the sedentary lifestyle. Not taking care of your wounds or infections, especially with cuts and things like that. Sometimes that can cause lymphedema to happen, like the lymph nodes just stop working, and then all of a sudden, again, they don't regenerate. So you'll have a bunch of fluid that's just sitting there in your extremity. Um, Repetitive injuries, so things like hurting your ankle over and over and over and not doing anything to help yourself causes swelling to that area, and then your lymph nodes in that area just get too tired to keep taking the fluid out, and that is a huge deal. That requires them to stop working. Really, I mean, once they stop working, they stop working. And then skipping medical follow-up. So for cancer treatments in cancer patients, a lot of the time they go through radiation or lymph node removal because their lymph nodes are affected by the cancer. And if, let's just say, everybody has different amounts of lymph nodes in their body, but if you take out 23 lymph nodes and you had 25 under your arm, a lot of times you only have two left. And so the two left are having a hard time doing the work of 25 lymph nodes, and you start to see swelling in the arm, and having to go through therapy to fix it, and not fix it, but just more manage it. Prevention of lymphedema. So the things that we can do, like I said, just making sure you maintain a healthy weight, taking care of any type of cuts and bug bites or anything like that, or trying to avoid it altogether. You can wear long sleeves outside or use off, things like that. You want to stay active to the best of your ability and do gentle exercises, especially when you already have a little bit of swelling. You don't want it to get worse. So, you can ice it, you can elevate it to the best of your ability during that time so it doesn't continue to just get worse and be more taxing for the lymph nodes. You can use compression, especially if you're walking a lot or you have a job that requires a lot of standing and being upright. Gravity plays a huge role in that, and so instead of knowing that your legs swell every day, by the end of the day you want to be preventative and wear compression garments so that they don't ever get that way and your lymph nodes don't have to work so hard overnight. And then just make sure that you're going to doctor visits when you're supposed to go to doctor visits. So definitely not avoiding those types of things and getting treatment right away if you start to suspect anything. And then lymphedema's impact on me. So I am actually a PTA. I graduated in 2017 and I have been working as a PTA since then. A couple years into working, I started to realize that there was a whole load of people that require this type of help. I started educating myself on lymphedema, and I went through a course that certified me as a certified lymphedema therapist. And so now what I do is I actually specialize in it, and I work for a hospital, and we see patients from all over Texas because there are not as many specialists um, in certain areas, especially little remote areas of Texas. They have to drive very, 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 very far to come and get treatment from somebody who's actually certified. And there's already a need for these types of doctors, nurses. A lot of people don't want to do wound care anymore or things like that. And so I feel like, especially because there's a huge need for it, being a lymphedema therapist means a lot to me, especially because I even had a coworker of mine. She was diagnosed with cancer, which is where you see the picture of the support squad with the pink bow, is to support her. She is also a lymphedema therapist, and she found out that she had cancer. And so it was really helpful that obviously I knew all the techniques. She also knew all the techniques, but it is difficult to do it on yourself, especially the compression bandaging and everything like that. And so lymphedema has a huge impact on me. I see a lot of patients that don't get the help that they need. There's just not enough research. There's just not enough help. A lot of insurances are denying claims for compression pumps that are desperately needed for people. And it's it's a huge thing out there. But education is number one. When you know what you can do to help fix that aspect and prevent yourself from having this problem in the future, and being proactive if you're ever diagnosed with cancer. Hopefully not, but if you are, going to the doctor and asking if going to a lymphedema therapist or starting a program would be helpful to prevent any type of symptoms like that. That's one of the biggest things. So I hope you enjoyed my presentation, and thank you. These are my sources. Don't forget to take a look.